Well, hello and welcome to this special Facebook Live with Dr. Binita Kane, where we will be discussing long COVID in children. We'll be discussing our own personal experiences because both of our children have long COVID. And we've gone down very different treatment routes to try and help them. And we'll be talking all about what we've done, and we'll be taking your questions, discussing everything from treatments to schooling and whether recovery is actually possible. But I think the best place to start is by asking, what is long COVID? Binita, thank you so much for joining us. How would you define long COVID?
Thank you, Stacey, and thank you for everything you're doing to raise awareness for the children who haven't had a big voice and so many suffering. So long COVID doesn't have a specific internationally agreed definition, although the WHO have recently come up with a definition, but generally it's accepted that if symptoms haven't resolved 3 months after a long COVID infection, or actually they have resolved and then symptoms recur after that time, that can be classed as long COVID. I think one of the challenges is that the symptoms are so varied and diverse, but some of the really common ones are fatigue, worsening of symptoms after exercise, headaches, palpitations, dizziness, behavioural change, rashes, but there's over 200 symptoms that have been described.
It's so upsetting when it happens. We both know how horrendous it is. What is actually going on inside the body when a child develops long COVID?
Well, the short answer is we don't 100% know, but there is a lot of research now that is giving us clues as to the different underlying mechanisms. So there's various different things, and that's important to understand that long COVID isn't the same thing in every child, and it will present with different things. So there's some theories around that the virus, parts of the virus hang around in tissues. So you can actually find, and in adults we've certainly seen this, you can find parts of the virus in lots and lots and lots of different body tissues, often for months, or even hundreds of days after the initial infection. So that's one theory that then drives ongoing symptoms. There's another theory that the body can start making antibodies against itself, so it almost attacks itself, and that can drive a lot of the symptoms. And then there's a theory around it being an inflammation of blood vessels, and there's quite a lot of evidence to support this now, certainly in adults, that actually the blood vessels become inflamed. Oxygen can't get across the blood vessels very easily into the tissues and muscles. They become starved of oxygen, and that can lead to that fatigue. And also, because the blood vessels are inflamed, they can trigger abnormalities in the blood and tiny little blood clots to form. And that's a theory that's definitely growing. There's lots of other potential mechanisms as well. I think this is one of the really challenging things about long COVID is there's so many different things going on. It's quite hard to unpick it all.
So what treatments are currently available on the NHS? I mean, just from my experience, when my son first became unwell, I went to the GP 5 times. Every time I saw a different GP, every time they looked quite blank and didn't really have an answer. The 5th time, or 6th time, I can't remember which, we ended up in A&E. They looked at us blankly again, even though my son had terrible gastro issues. And it was very, very difficult to get any answers. They kept saying, we'll refer you to the long COVID clinic. But we waited 13 months for that referral, that letter to come through. And we were just clinging hold of this hope that this treatment, this diagnosis was coming. And I know that that's something that so many people have experienced, this desperate wait for answers that just doesn't seem to happen. I mean, the answers never came.
Yeah, and I think to understand why we're in this situation, you almost need to look back at the history of post-viral illnesses. So illness post-viruses is not new. It's been around for decades. So we've got a condition called ME/CFS, which has affected children for decades. But the challenge has been that it's a very, very neglected area of research. And I, as a doctor, I'm a consultant, respiratory physician. I've been a doctor for over 20 years. And I never got taught anything about it at any point, and we still don't teach people about it. And there's been a real dearth of research as well. And so pretty much everything I've learned about post-viral illnesses has been in the last couple of years. There's this real knowledge gap between the research that's out there, what people in clinical practice know and understand, And I think at the same time, there has been this sort of labelling of these conditions as almost psychological over the years. And so therefore, a lot of the services that have supported children with ME have really just been therapy based and talking based and physio based. But what we know now is that some of those treatments and therapies that have been advocated in the past, like exercising and pushing people to exercise, can actually be really, really very harmful. So in ME, that's all been taken out of the guidelines. And long COVID will be part of the same spectrum. There are definitely some differences. And so I think the reason people are struggling is because there's just been this real silence. And now suddenly we've got millions of people all around the world who've got these post-viral illnesses, and there's been a massive explosion in the research, maybe not so much in children, definitely in adults. We're starting to understand a lot more about it. And it definitely isn't a psychological illness. And I want to just say that very specifically. Yes, of course, psychology can play a part in any chronic disease or any chronic illness, and it is an important thing to address. But there are physiological and medical things going on at the root of this that we really need to understand if we're going to treat it properly.
I mean, I think it's worth pointing out, as a doctor, you face exactly the same struggle as all of us. You decided to go down a different route. You took your daughter to Germany. Just tell us a bit about why you did that and how you found some answers.
Like you, we did go down the NHS route, and my colleagues in the NHS were very helpful, very kind, very nice. We had the basic sort of tests done. The thing that we're finding, though, is that the tests that we are doing in long COVID are not picking up the abnormalities that we're seeing in the research, because that's all happening at a very micro level, whereas our tests are very macro. They're kind of big picture tests. But what we really need is to get down to the sort of the nitty gritty of what's really happening. And those tests are only available in the research setting. So once we had got kind of all clear, we were referred into a service which only offered us physio. And the physio was lovely and very supportive, but actually it wasn't helping my daughter get better. And I just thought, look, she's really ill. She was a perfectly healthy 10-year-old child before she got ill. And we were at a stage where she couldn't walk more than 50 metres up the road. She needed a wheelchair for distance. She didn't go to school pretty much for a year, bar a few hours here and there. And I thought, this isn't right. We can't just accept this level of disability for a child. I just wasn't prepared to take that as an answer. So I started going a bit off piste then, and connecting with various researchers across the world and other patients and other doctors. And we went out to Germany with the help of a friend and colleague of mine. And what they did was they took her blood and they looked at it under a microscope. And it looked like it was quite thick and sticky. So she had the type of long COVID where it affected her blood. And once we'd seen that, we were able to actually treat those, because there are treatments that can treat those abnormalities. And just slowly, over sort of 6 to 8 months, she recovered to the point where she was able to start high school in September full time, which is something we couldn't have even dreamed of this time last year. And so I have been really advocating to push for research, because I've been extremely privileged to be able to have done that and to have the supervision of a specialist abroad. But really, we need to bring this research to the UK and offer it to children. I'm not saying that's the only research. There's lots and lots of stuff we have to do, but that's just one part of the puzzle.
I mean, that was one of the questions that we had received, is people understand that you've been to Germany, they understand the process and what happens. How long do you think it's going to be before we get microclot testing and the treatments that you've received here in the UK?
It's going to be a long time, because at the moment there is no drive for us to do it. There are groups in the UK, including one that I'm leading, where we are trying to get it up and running. But we're up against a system that isn't investing. We're having to apply for funding against all the other people applying for funding. So it's very competitive. You may or may not get money. And And actually, I'm not a paediatrician or a researcher, so I'm having to essentially do it in my own time. And all the other research that's going on in the UK is very much in adults. So there is this void. I mean, there is some other paediatric research going on in London, but it's slow and it's very much at the stage of we're still trying to understand what's wrong in children rather than translating that into treatments. So it could be years without the investment and without the government really prioritising this for us to see anything. And our children don't have years. They've already lost a significant amount of their childhood. Some are now entering their 4th year of being ill.
I mean, it's incredibly scary, isn't it? You must feel very frustrated by that.
I do, because I've seen the devastation both in adults and children. You know, we've 2 million adults in this country who are affected, and quite a significant proportion of those have been ill for well over a year. And this is our future workforce. It's our future generation, and we're going to have a proportion of children who are disabled moving forwards unless we sort this out. We saw during the early days of the pandemic that when you really put the effort in and the funding and the drive and the energy, you can do research really quickly. And we did that for acute COVID. We got the vaccination, we got all the treatments that we give in hospital, but we just haven't seen that same prioritization, that same funding for long COVID. It's almost like if it's not an acute problem and people aren't dying in hospital, it's less important. And that is very frustrating because we know how many are suffering.
We're just going to take a couple of questions now, Binita, and then we'll come back to our chat. Chris wants to know more about hyperbaric oxygen treatment.
Yeah, so again, it's a treatment that's being used by lots of people with long-haul COVID. There are a couple of randomized controlled trials in adults to show that it can improve brain function and cognitive function. It's been very well established in diseases like MS and also in brain injury in the past. So, and kind of thinking about how it works, it essentially is forcing oxygen into cells that are starved of oxygen. What I do know from the people who've tried it is the effects aren't necessarily immediate, they're not necessarily long lasting, and so people have needed to top it up. It's expensive, it's not very readily available, and we don't have the trials in children to know whether it works or not, and it doesn't work for everybody. So like a lot of the treatments that people are trying, without having them in formal trials, it's very difficult to say, well, yes, this works and that works. And I think where we need to get to is have specific tests where we can understand what's going on in the individual child and then tailor the treatments accordingly. But that needs a massive amount of effort, data collection, research, and money.
I mean, I'll give my view on hyperbaric oxygen therapy. I know a couple of adult friends who tried it and found it extremely helpful. I mean, transformational. I tried it with my son. He couldn't bear it for more than 10 minutes. The pressure in the chamber was too much. He found it very scary. And I think one of the things that I learned going through this journey was that stress is very, very damaging to children, and I think to adults as well. So anything that they find stressful will worsen their symptoms. So I think with a child, hyperbaric oxygen therapy is maybe something that you can look into, but my experience of it was not that great. But I'm just giving my opinion.
Yeah, I don't know too many children who've tried it. My experience I'm talking about in the studies is very much in adults, and of course it's effectively putting them in a chamber. It's a bit like being on a plane, and so the pressure builds up, it can hurt their ears. So it's hard to know, and it could be that children need slightly different pressures, because I think at the moment they're just going into adult chambers, aren't they?
They are. And Kat asks, what is the best way to deal with post-exertional malaise? Everybody's dreaded symptom of long COVID. So
just for those who don't know, PEM, or post-exertional malaise, also known as post-exertional symptom exacerbation, or PESE, is kind of the hallmark of long COVID and against hallmark of illnesses like ME, CFS. The way I try and explain this to other people is that imagine the child's energy levels are like a phone battery. So a healthy child will wake up with 100% charge after sleep. Someone with ME or someone with long COVID might wake up on 50% or 20%. depending on how severe they are. And then absolutely everything they do during the day zaps that energy, like if you've got all your apps running on the phone. And if you don't then stop and recharge the energy levels regularly during the day, the battery can run out and that can cause a crash. And you can actually accumulate an energy debt as well. So it could be that they manage something and then 24, 48 hours later, they have a big crash. And so energy management is like a really, really important part of managing long COVID. And I think what I hadn't appreciated or realized is that the thinking and the cognitive exertion can be just as disabling as the physical. So even watching television when my daughter was at her worst, things that you think would be relaxing were draining her energy. And actually, I think the therapy-led services in the NHS, this is the one bit that they really can help with. If they're a good service who really understand PEM and understand pacing, which most of them do, that's where I think the NHS clinics can really come into their own to help manage the symptoms.
I think we were discussing earlier about gaming. I mean, my son, when he was at his worst, would literally game all day, every day, because what else can you do? He was too tired to go out. And he needed something to engage with because he was so bored. What you said to me was that gaming really isn't resting and that you have to be quite careful with that. And it's a very difficult concept to get across to children, especially because gosh, when they're having fun doing anything, you want to give them that opportunity. But just to be mindful that when they're gaming, they're not resting.
Yeah, and I think this is where maybe explaining a little bit about the autonomic nervous system would be helpful. So the autonomic nervous system is what controls all of our body's automatic functions. So the nervous system people think about might be brain, spine, and, you know, if I want to lift my arm up, there's a long nerve and I can do that. That's conscious. But there's a load of stuff going on in the background, like how your heart beats, how your blood pressure is maintained, your digestion, breathing, which we don't think about. And it's controlled by this ANS, the autonomic nervous system. And that's got two components. So it's got the fight or flight, or the sympathetic nervous system. And then it's got the opposite, which is the rest and digest, or the parasympathetic. And what we know happens in long COVID is people get stuck in the fight or flight. And therefore, anything that can bring the child back into rest or digest, which is where healing takes place, is a good thing to do. Now, the big challenge is that for children, those are things like resting, mindfulness, breath work, being off screens, not being on TikTok, you know, nothing that stimulates. And so for us, it was a real battle trying to get my daughter to engage in any of those activities, because also when she was really wired, she didn't want to do it and she was quite oppositional. But when she was at her worst, we used to have to make her lie in a dark room 3 times a day with absolutely no stimulus for 15, 20 minutes at a time, because it was the only way we could recharge her batteries. So some really practical things are making sure that you're limiting screen time, that what they're watching on screens is not really stimulated. Gaming, I think, does get that adrenaline going. So it might be particularly bad depending what they're playing. And then there's lots of things you can do to calm the autonomic nervous system. And we can talk a little bit about that later.
Yeah, well, I mean, let's do it now. I mean, what can you do to calm the autonomic nervous system down? Because, I mean, I know that you go cold water swimming. That's one of the things you do. I'm not sure I'll get my son into cold water. But, I mean, just describe what things you do.
Yeah, so the vagus nerve, which is really important in that rest and digest. So anything that stimulates the vagus nerve and counteracts that fight or flight can help. So cold water immersion is quite an extreme sort of thing to do. You don't have to go swimming in freezing cold water. But even just doing a little bit of cold water exposure, so turning the shower onto cold for 30 seconds or 15 seconds at the end can make a difference, or splashing cold water on the face. One of the branches of the vagus nerve is at the back of the throat, so gargling with ice cold water. And then breath work's really good. So children tend not to be able to meditate because it's quite challenging to do. but doing some box breathing, so in for 4, hold for 4, out for 4, hold for 4, and just incorporating that into daily routine if you can. None of these things by themselves are going to cure the child, but what I find is the people who get better tend to be doing a little bit of this and a little bit of that, and they perhaps have a little bit of help from medication, and they manage their energy and they do little bits and pieces of this, and all together it makes a difference. So even doing 5 minutes once a day is better than nothing, because along with other things it can help.
I think that's a really valid point there, because this whole situation is so stressful. You don't know what to do for the best. And it's impossible to try and get children, well, in my experience, it was impossible to try and get children to meditate and do all of those things. But lying on the bed and spending 5 minutes before you go to sleep doing breath work, and you do it with them, because I think that was the only way I could make my son do any of it, definitely calms them down. And sleep is incredibly important, isn't it? Sleep, one of the things that you have to get right.
Yeah, sleep is really important. And again, some very practical things that you can do. Have a bit of a wind down routine, so making sure screens are off for an hour before, making sure they're not having fizzy or caffeinated drinks during the day, maybe after 12 o'clock, ideally not at all, that they're well hydrated. You can also get a relative deficiency of the sleep hormone, which is called melatonin. Most of melatonin is actually made in the gut. And so because the gut can be affected by long COVID, children and adults can get relatively melatonin deficient. So actually starting my daughter on a very small dose of melatonin was an absolute game changer. And she still needs that, actually. And we've tried to stop it a few times, but or she's forgotten to take it, and she still notices a difference. Now, that was prescribed from a specialist clinic, and GPs may or may not want to prescribe that, but it is something that's commonly used in ME, for example, in children. So that is something that's got a precedent, if you like, to be used. It's something that people can look into. Magnesium supplements as well can sometimes be helpful for sleep, but getting that routine with or without any additional medication is important.
You mentioned the gut there. I mean, I know from my experience, the gut has been something that is extremely important. I know that my son's microbiome was incredibly disrupted, and we have focused an awful lot on prebiotics and probiotics. I have no idea whether it's worked. This is the problem with all of these things. You do all of these things and you have no idea whether it's that particular thing that's worked. But I think it's definitely something that's worthy of discussion.
Yeah, and there's increasing evidence all the time, actually. There's one randomised controlled trial in adults that was done in Cambridge where they used probiotics, and that did show a benefit in the group that used them. I think it's something which there is a precedent, again, of using them in children. You can get probiotics that are designed for children. What we don't know is how long, which one, what's the impact, because the studies haven't been done. But it's one of those that I think probably won't do any harm, might do some good and worth a go. I think cost comes into it because they're not cheap. And so actually, if we're in a cost of living crisis, and if you don't have a lot of money, it's very difficult because you can't get those sorts of things on the NHS, and that's where inequalities start coming in. And that's really difficult, really hard. But for those who are privileged enough to be able to afford it, it's something that could be tried.
I know one thing that we definitely wanted to cover was POTS and the tests that you can do at home to try and find out whether your child is suffering from POTS. Just describe what you can do at home and what you can do with this information once you find out if there is a problem.
Yeah, so POTS stands for postural, which means to do with posture, orthostatic, which means against gravity, tachycardia, fast heart rate syndrome. Okay, so it's a bit of a mouthful, but POTS is a bit easier. Now, in preparation, I have my little water bottle. Now, if you imagine that your child is lying down, the blood is distributed nicely. Imagine that's their head. When they stand up, what should happen is the autonomic nervous system should very quickly take lots of information in and tell the brain, I'm now standing, or the child is now standing. And then, because gravity is pulling all the blood down, the leg vessels should squeeze, and then that column of blood should go up so the brain isn't starved of oxygen. And this fails to varying degrees in long COVID. And at one end of the spectrum, you've got just a fast heart rate when someone stands up. At the other end of the spectrum, you've got POTS, where people can literally pass out when they stand or cannot tolerate a standing position at all. So the symptoms are things like dizziness, palpitations, chest pain, particularly on sort of standing. And it can cause a whole host of symptoms that are very, very common in long COVID. And I think this is hugely underdiagnosed in children. It's something that's very well described in children and adolescents pre-COVID, just wasn't very common. And I think it's become much more common. So it's not, it's quite complicated when you start getting into all the physiology, but something very simple that people can do if they've got access to one of those oxygen probes, a pulse oximeter, that measures heart rate. And so you can check the child's heart rate when they're lying down. And then they just need to be nice and calm for about 5 minutes. You can either stand them up, or if they're going to struggle to stand, you can lean them against a wall. And then just measure the heart rate over 10 minutes and just see what happens. Now, the cutoff to say it's definitely POTS is 40. So if it's 60 when they're lying down and it goes over 100 on standing, well, that's pretty much home and dry POTS. That 30 to 40 is kind of a bit of a grey area. And I think if you're going to do this properly, that simple bedside test, but actually a really good history from the patient, looking at their symptoms, looking at what their risk factors are for POTS, and putting it all together and working out, is that response normal or not? Few caveats that depending on what time of day you do it, what day you do it, whether they've drank enough, whether they haven't, that can influence the results. So it's not absolute a one-time test only. And this is what makes it really hard. They might go to the doctor, have it done on one day, it's not POTS, but then the next day the heart rate could be 120 when they stand up. So there's lots and lots of shades of grey. The good news is that it's treatable, and there's lots of stuff we can do to treat POTS. All the way from lifestyle stuff like increasing fluids, increasing salt intake, wearing compression garments, to medication that will help slow that heart rate response if needed. And then there's various, things like beta blockers, and then there's various other drugs that can be used as well. So it's something I think that's underdiagnosed. It's quite simple to diagnose if you know what you're doing, and it's treatable. And so it's important that I think people are aware that this can cause many of the common symptoms, and it can cause the fatigue and the exercise intolerance as well.
So in simple terms, if you think your child may have POTS, do the test a few times at home, go to your GP armed with those figures so that you can say, these have been the readings that I've got over the past week, so that they're not dismissing you if that one reading on that day does not signify POTS. I mean, I think that's a really important message. And then try and push to go and see a cardiologist, because that's what I did. Instead of waiting to go to the long COVID clinic, that wasn't going to happen. Look at the symptoms that your child has, break them down. My son had gastro issues, cardio issues, joint pain. There were so many things, and go to those specialists of the individual issues rather than waiting to go to the long COVID clinic. Because if you talk about long COVID, sometimes you're dismissed. If you talk about individual symptoms, sometimes you're not.
Yeah, I think that's such an important point, Stacey, because long COVID's just become this amorphous sort of diagnosis that people kind of almost, their heads in their hands as soon as thinking about it. Oh, we don't have any treatment. But actually, it's made up of lots of individual syndromes sometimes that we do have treatments for. And as you say, it's about getting in front of somebody who understands it. Now, a few caveats that POTS was only described really in the early 90s. So in terms of medicine, it's a relatively new sort of illness. And there is a poor understanding of it amongst doctors. And even cardiologists sometimes wouldn't necessarily have the expertise in how to treat it. So it's finding the right specialist, and that can be really, really hard. But it is treatable, and I think it's important. There's some really good resources like the POTS UK website. There's a doctor called Dr. Sanjay Gupta who's got a brilliant website as well with loads of videos explaining stuff. So if families can educate themselves about it, that can really help getting the right help and support.
We're running out of time, Binita, but I know one other subject that's really important is mast cell activation syndrome. And I know from my experience that the H1 and H2 blockers were a game changer. So I just want you to talk about mast cell activation, what it is, and what we can do to treat it.
Yeah, so mast cells are little cells. They're part of the immune system, and they're stuffed in every tissue in the body, and they're kind of near the surface. And their job is to survey the outside world and make sure stuff that shouldn't be getting into the body doesn't get in. But when they go rogue, so COVID can cause them to become hyperactivated, they can start causing problems and releasing inflammation and things like histamine. So because they're in every organ, they can cause symptoms in every organ, from the brain to the gut to the bladder to joints and bones. And people who have an allergic tendency sometimes can be more prone to mast cell activation. So people who've had asthma and hay fever and eczema maybe as a child, and sometimes those things really flare up post-COVID infection, and people don't join the dots and think, oh, it could be mast cell. Again, there isn't really a diagnostic test, but if this is something that resonates, maybe new food intolerances, worsening asthma, this is something that could be very, very treatable. And I've had adult patients that I've treated this, and they have really, really got a lot better. So you've mentioned H1 and H2 blockers. They're fairly old school drugs. It's antihistamines and drugs like famotidine that are really quite low risk. That could be just trialed if we think this is an issue. I would, as long as people understand that there might be side effects, you might have to stop them. I don't see the harm. I'm not a paediatrician, so that obviously you'd have to have that discussion with the doctor. But in adults, it is something that people are actually able to get hold of. Sometimes you need more than one drug. You need, sometimes in the more severe cases, 3, even 4 drugs to get it under control. But again, it's something that is treatable and maybe isn't being recognised and treated as much as it should.
I just want to point out, Binita, you're not a paediatric doctor, so we're not telling people what to do in any way. We're just giving people information to take that away and to consult with their GP. But these are just things that I'm saying has helped me. I think just before we go, it's worth saying this is an incredibly, incredibly difficult illness to deal with. I mean, just briefly, just describe how it was for you, coping with it in those darkest days.
I mean, it was completely devastating, and it affected our family in every way in which it could. And my husband ended up having to give up his business and work to be at home all the time. So, it affected income, all of that stuff that you perhaps don't think about. We found that the Long COVID Kids webpage was absolutely so helpful. It gave us a community that we could reach out to. There was loads of resources on there. It's a brilliant charity. If anyone can support and donate to Long COVID Kids, they're doing absolutely incredible work, especially around the school support, which was an area that we, even someone who knows how to navigate the public sector like me, I really struggled with it. And I had all the support from health professionals because I'm a doctor. We got lots of kids who are stuck in that hole between, I don't have a diagnosis, but I can't go to school and I'm being fined for not going in, and my attendance is low and I'm being forced to go in. And that can be months and months and months, and families are really struggling with that. So there's great resources on the Long COVID Kids webpage around schools. They've got a brilliant pack you can download. You can even share it with schools. There are other websites as well. We've not been able to touch on PANS, but that's the neuropsychiatric sort of behavioural change that we can sometimes see in COVID. The PANS Pandas UK website has got information on there. But yeah, I think my sort of take-home message for anyone watching is there's lots we can do. There is really a lot we can do. It's just finding someone who's willing to have that conversation and try some treatments. That's the challenge at the moment. And in terms of the slightly more risky treatments like the ones my daughter had, I'm not advocating people go away and experiment because they can cause bleeding. We don't want people to have them if they don't need them. We need the tests to understand who is going to benefit from those drugs. That's going to need the research and the investment.
I think that's a point you picked up on there about schooling. I just want to briefly say my son was in 2 different schools during the worst part of his illness. The first school was not great, if I'm honest. The second school he went to was absolutely incredible, and that made such a difference to his recovery. Things like having lessons off, maybe doing 1 lesson, having a break, not doing PE, not doing lessons that he finds stressful, so not doing languages where he had to remember lots of things and where he found it really stressful. So any lessons that your child finds stressful, maybe ask if they can sit out for those and catch up at home or catch up at a time where they can. I think people think, oh my goodness, they can't go into school, they found that doing 2 days in a row impossible. If you structure it differently, sometimes children can be in school but not necessarily in the lesson, which improves their mental health. And there's lots of small things that you can do which makes a massive difference.
Yeah, completely agree. I think children with long COVID can learn. It's just school is a really inappropriate environment for them because it's noisy and they might be light sensitive and sound sensitive, and they've got problems concentrating because of their brain fog, and they're fatigued. So doing 8 hours in a row is really hard. So as you've said, it's chunking work into smaller periods. My daughter used to go out and have breaks every hour. They'd find her a quiet spot and she could just go and have a break. And she used to go in for like an hour, maybe 3 times a week when she was at her worst. And that's okay. I think we got to a point where we just took her out of school because we realized that was more important for her recovery, because school was making her ill because she was doing too much. That was a really hard decision, but in hindsight it was the right one because she just kept crashing. And I think that probably made her worse overall, worse than she needed to be.
I think that's a really important point, is that I took my son out for 7 months. He just couldn't cope with it at that point. It's a very hard decision. It's really, really tough. But if you let children rest early on, it seems that the benefits come later. Children have to recover. And if they're constantly overdoing it with school being too demanding, they're not going to recover.
Yeah, and not pushing things like PE, really, really important, because like sport, exercise, that can actually make them worse than they were before if they really overdo it. And so but there's a functional ability scale that the ME, that has been designed for children with ME, which I found really helpful because it kind of gives you grades of severity. And I was able to say, look, Jasmine fits the 50% on this, and I was able to quantify how ill she is. So that's something that I found really helpful in the conversations with the school, along with we had a medical plan that was signed by her consultant because we were lucky enough to have one. And then she also had a risk assessment because we know reinfection is really not good for children with long COVID. It can set them back. It can really set their symptoms off again. So she didn't used to eat in the dining room, for example. She was allowed to eat in her classroom with her friends with the windows open. Just anything we could do really to make the school environment as safe as possible. And the school were great. They allowed me to put HEPA filters into her classroom. So we crowdfunded and bought some HEPA filters for the whole school. So there's things you can do to make that environment safer as well.
I think that's a very, very good point. HEPA filters if you can, masks if you can, not going in the lunch hall, not changing in the changing rooms. Anything that you can do to avoid reinfection has got to be a good thing.
Yeah, and I think much as we would love to pretend the pandemic's over and COVID's gone away, it really hasn't. I mean, when you look at the figures at the moment, it's estimated sort of 1 in 40 people in England have COVID, and I'm still seeing it on the wards every day. So it hasn't gone away. It is still a risk. And the best way to avoid getting long COVID is to avoid getting COVID. So the more that people can advocate for clean air in schools, the better, because we are still seeing children who've had COVID within the last 6 months now joining the Facebook group and the support groups, which is really sad because I do think it could be prevented if we tried harder.
Couldn't agree more. Dr. Binita Kane, thank you so much for joining us this evening. Every time I speak to you, I learn so much. So thank you very, very much for your time.
Thank you. Thank you, Stacey.
Thank you for all your questions. I really appreciate all of them, and I hope you've learned something from watching too. We are both available on Twitter, and so if you have any questions, do get in touch. But for now, Thank you for watching and good night.